There are still many questions surrounding COVID-19. We know that some people are at particular risk, while others never seem to catch it at all, but we don't know why. Welcome to our COVID-19 special. In China, attempts to control the virus with strict lockdowns and homegrown vaccines achieve mixed results. While Ghana struggles with vaccine hesitancy, Rwanda is building a vaccine factory. But first, let's look at why many people never develop symptoms. We spoke with one of the researchers who discovered the Omicron variant. We've all heard stories of healthcare workers who've worked for months or years on COVID-19 wards and apparently never caught it. Or of families where everyone came down with the virus during isolation except one member. Some people just don't seem to get the disease. We still have no way to predict who might have this apparent superpower.
I think the first factor is basically chance. So I mean, one can have luck and one can be unlucky, and I think that one cannot, one should not underestimate. But still, of course, the question is, is there a pattern to it? And I think it is probably a multifaceted phenomenon.
There are ways anyone can lower their risk of contracting COVID-19. You can reduce your exposure by wearing an effective mask in indoor public spaces, for example. And vaccines also have a powerful protective effect because they stimulate the body to produce antibodies against the virus. At least for a few months, that can provide strong immunity.
Immunity that would be induced by vaccination and or natural infection, having survived the infection, or a combination of both, which we are seeing more and more. The question is, are there any other infections, particularly with other types of coronaviruses, that would leave one somewhat immune?
Is that factor possibly also playing a role in at least some people who appear resistant to COVID-19 infection? Some studies indicate it does, that previous exposure to one or more of the 4 related coronaviruses that only cause cold-like symptoms in humans might provide some protection. Infection with those largely harmless viruses causes the body to form longer-lived immune cells called T cells to recognise and fend off future invasions of them. And, at least in some people, those T cells might also recognise close viral relatives, like SARS-CoV-2. The phenomenon is known as cross-reactivity.
Cross-reactivity refers to a similarity between different agents. And of course, if they're all coronaviruses, one would expect them to have similar structures in the form of the viral proteins that will elicit the immune response. And if these structures are similar between different viruses, it can lead to cross-immunity. And that is a very common phenomenon.
Cross-reactivity could explain why some people can fend off COVID-19 for at least a while. And for a select few, there might even be a more permanent defence. Some scientists think a small subgroup of people could be immune to infection with SARS-CoV-2 entirely, if the DNA in their cells carries certain genetic factors that we haven't yet discovered. We've seen this kind of genetic resistance before.
Now, we know the phenomenon of genetic resistance against certain infectious diseases. A famous example is sickle cell anemia, which confers resistance to severe malaria, but comes at a high price. Sickle cell anemia can cause crisis and needs to be treated in its own right. Another genetic variation that was discovered about 25 years ago gives protection against HIV, either infection as such, or at least progression towards AIDS, the final end-stage disease. So we know such examples, but they're very difficult to unravel.
Inborn immunity to SARS-CoV-2 could hypothetically occur, for example, in people whose genes cause them to produce an altered version of ACE2, a protein receptor on the outside of cells that the virus uses to break in. So if the ACE2 in some people is different in some key way, that could prevent the virus from latching on, effectively preventing the person from being infected. Studies are looking at a range of different possibilities.
The main purpose of such studies is to elucidate the mechanisms, and hopefully in the end come up with some strategy like a drug or something like that that would exploit it for prophylaxis or for therapy.
True genetic immunity, if it exists, is likely pretty rare, but experts haven't ruled it out. China has tried to get the pandemic under control with a zero-COVID strategy of strict lockdowns and vaccinations. But it's only using homegrown jabs like Sinovac, none of which are mRNA vaccines, which have proved to be the most effective elsewhere. Now Beijing is getting ready to approve its own mRNA vaccine. So will China's approach to lockdowns change too?
Helping everyone live a healthy life. That's the message vaccine developer Valvax sends out on its website. Its mRNA-based COVID-19 vaccine is currently undergoing phase 3 trials and could be ready to market soon. Most people in China have already received other Chinese-made coronavirus vaccines, but an mRNA jab could offer them added protection.
mRNA clearly has more, the efficacy level is higher, is better than anybody else, than everything else, I think. So I think it's still worthwhile to invest in to make the messenger RNA vaccines and to basically just increase the efficacy.
A preliminary study indicated that a booster shot with Valvax's mRNA vaccine provoked a stronger immune response than one using other Chinese vaccines. Still, China has a way to go when it comes to producing its own mRNA vaccine. 5 more coronavirus vaccines are currently under development here.
China's motivation is, on the one hand, national pride. And there's the race for this new mRNA vaccine technology, where it wants to keep pace with the West. China didn't want to become dependent on the West. BioNTech, together with a Chinese partner Fosun in Shanghai, submitted an application for approval of its mRNA vaccine in China, but it hasn't been fully processed or granted to this day.
Björn Alpermann is a Chinese policy expert. He says it's this national pride, in combination with the miscalculation that Omicron could be contained by China's zero-COVID strategy, that have led to the country's current problems. Mass testing and hard lockdowns have impacted China's economy and led to growing discontent amongst the public.
Right now, China's problem is that despite its relatively high vaccination rate, the protection provided by its current vaccines is relatively low against Omicron and its subvariants. And also a fairly high portion of the older population is either not protected through vaccinations or not enough.
Compared to some other wealthy countries in the region, China's vaccination rate for people over 60 is still relatively low, standing at around 82%.
And of course, it's precisely this vulnerable group of the elderly that China aims to protect. The Chinese government has long touted that it takes protecting lives in this pandemic more seriously than the US government does, for example. There, freedoms were considered to be more important, but at the cost of many lives.
Now, with its first domestically made mRNA vaccine in sight, will China change course? Political experts say not yet. They only see that happening next year after Xi Jinping has secured his 3rd term as president. And virologist Feng Gao is convinced even the current Chinese vaccines provide good protection against COVID-19, as long as 3 doses are administered. So an mRNA vaccine wouldn't change the country's basic approach.
When everybody's vaccinated, then people, can get just like now, the vaccinations, seems like Omicron getting less pathogenic, or it's not causing severe disease anymore. So maybe if that is the case, that's still the trend, and from now on, so that might help the people to relax a little bit.
But for now, it looks as though even getting its own mRNA vaccine won't fundamentally change China's COVID policies.
Do you have any questions on COVID-19? Our science correspondent, Derek Williams, has the answers based on the latest research and analysis. Send an email to covidproducer@dw.com. This week, one viewer wanted to know, will we need annual boosters against COVID-19 in the future?
Any prediction that anyone makes at this point on this question is going to be speculative because we just don't know how much more the virus is going to change in the future. And that, of course, will be key to how long vaccination defenses remain robust. But I definitely think that it makes sense to step back for a moment and maybe think about our goals. What do vaccines really have to do to be considered successful? And what would we just really like them to do? Because those are two different things, and they'll ultimately decide whether we think yearly boosters are a good idea in the future or not. So let's look at what a vaccine kind of has to do first. At a bare minimum, I'd say it should keep COVID-19 from killing pretty much everyone and also provide significant protection against getting severely ill to at least the vast majority of people who receive it. That protection should also last more than just a few weeks or a few months. Right now, in this Omicron phase of the pandemic, that's kind of the problem. Vaccines are preventing most severe disease, but some people are still catching COVID-19 even after being recently boosted, which is why healthcare authorities in many places are now recommending a fourth shot, especially for the elderly or for the immunocompromised. Reaching those simple benchmarks on what a vaccine has to do depends on a few factors, especially how long-lasting and robust of an immune response the vaccine evokes in the average recipient, but also how quickly the virus evolves to get around that. What recipients would also really like for a vaccine to do, of course, is to prevent symptomatic disease entirely. And if that's the goal, then some kind of regular booster in the future suddenly looks a lot more likely. We already have to develop annual vaccines for influenza viruses. And some researchers now think that SARS-CoV-2 is evolving just as rapidly. If that continues, then regular updates of COVID-19 vaccines will probably be necessary, possibly administered seasonally along with flu shots or maybe as a nasal spray. Of course, the coronavirus could also evolve to cause such harmless disease that we all stop worrying about it. But even if that one day happens, most experts don't expect it to be anytime soon.
Ghana was the first country in Africa to take delivery of COVID-19 vaccines under the UN-backed COVAX initiative. But so far, less than half of its 30 million people have had the jab, even though millions of doses are available. But not all Ghanaians are hesitant, with some now lining up to get their booster shot.
Elvis Ajeti-Sowa is a lecturer and a researcher at a public tertiary institution in Ghana's capital, Accra. He hasn't been to work for days, following a surge in COVID-19 infections at his school. Sowa is staying away from work as a precaution.
I also have an elderly mother and an auntie who also have other conditions like diabetes, like hypertension, which also puts them at risk. And so that was the situation, and that was the kind of apprehension I had, that if I contract the virus, just as some did at my place of work, then I could also infect these people, either my kids or my parents. So that was a challenge, and that's how come for this I was not able to go to work here.
Sowa went for his COVID shots at the peak of the pandemic. But regular visits like this to his elderly mother, who has diabetes and suffers from high blood pressure, means he must be better protected. He's already thinking of getting a booster shot. So far, Ghana has administered 17 million COVID doses to about 11 million people. Millions are still hesitant about the vaccines in general, let alone getting a booster shot.
The first shot gave me like a terrible, severe pains, and I was having negative effects about it after taking in the drug. So maybe I'm thinking after taking the second one, it might even get worse or something. So I'm trying to avoid, as and I'm good, I'm not taking any, but yeah, I'm okay now. So taking the second and the third one, to me, is very bad.
I just didn't feel like taking it. I don't really trust it. I don't really have trust in that thing.
I don't get time to take it. That's why I didn't take it. And I'm sure that I'll take it. Maybe next week I'll take it.
Health officials are concerned about the level of hesitancy towards the vaccine. Their focus now is getting those who are vaccinated a booster shot.
We realize that after some time, the immunity goes down, and so you need to reinforce your immunity, because COVID hasn't gone. COVID is not going anywhere. It's come to stay with us in a way. We should put it bluntly. And therefore, we need to protect ourselves. Now that we know how the disease transmits and how we can prevent it, of course, the best thing is to prevent yourself. And therefore, reinforcing your immune system is very important. That is the essence of the booster.
Okay, great.
Today, Sowa is making inquiries about where to get his booster shot. He hears about a hospital just 5 kilometers away from his home. This centre, just like many across the country, is almost empty. Sowa is among just a few people who've come today to be vaccinated.
Oh, really?
Your diet.
I have this conviction now that I have better immune system to protect myself, to protect my family, other colleagues, and of course my loved ones. So I'm excited.
Sowa is going back to work for the first time in days, but now with his booster vaccination. He feels more confident now about his protection from COVID-19.
In the first nearly 2 years of the pandemic, Africa was always last when it came to vaccine supplies, not least because there were no production sites for vaccines in Africa. German company BioNTech is now building a plant in Rwanda. But will it help solve future problems?
Behind these inconspicuous signs are grand plans. Here in the Rwandan capital, Kigali, the German company BioNTech is building a plant for mRNA vaccines. CEO Uyar Shahin welcomes the president of Rwanda, Paul Kagame, along with other high-ranking officials from other African countries. For them, this is not just about laying a foundation stone, but about gaining expertise and highly qualified jobs, and being able to stand on their 2 feet during the pandemic.
Vaccine manufacturing requires a highly skilled human capital. I'm happy to announce that Cabinet has approved the establishment of the African Biomanufacturing Institute, which will provide training and qualification for this industry.
BioNTech aims to have the mRNA production lines ready in 6 months. The first vaccines are scheduled to leave the factory in 18 months. This is made possible by what it calls the Beyondtainer. It allows key elements of the vaccine production to be brought quickly to any place in the world using a modular process. The vaccine plant is also a hot topic 30 kilometers away in the Mugina region. The people here live mainly from agriculture, and getting to a doctor or hospital is a long and exhausting journey for many.
BioNTech's African mRNA manufacturing plant will greatly help to prevent any disease that may occur in our countries. And if these vaccines are manufactured here, the purchase price will not be high, and that will help us to fight the next pandemic.
Like most other countries in Africa, Rwanda now has enough vaccine against COVID-19. But in the first year and a half of the pandemic, it was very different. The vaccines were developed by companies in Western industrialized countries and were first used to inoculate their own population. There was the international vaccine initiative COVAX, which was intended to bring vaccines to poorer countries, but deliveries were slow for a long time. Dr. Gisela Schneider has been supervising vaccination programs in Africa for years. She saw the disappointment of the people there firsthand.
The young Africans say they need their own structures. Their experience during coronavirus was that COVAX sounded good, but they still had to wait at the back of the queue. They want to take things into their own hands. They want the rights to continue their own mRNA research, to produce their own vaccines.
In terms of Africa having its own production sites for vaccines, BioNTech's work is a step in the right direction. But much of the expertise remains here at BioNTech. Local researchers say they will only benefit if the patent rights are released.
Everyone wants to have mRNA manufacturing on the ground. And then we have to agree on a collaboration plan, which is a complex project. And we have to agree who is contributing what.
That's why South African scientists are developing their own mRNA vaccine in Cape Town to be independent of the patents of Western companies. It will take some time before Afrigen delivers results. But the idea is that African countries will also have access not just to vaccines, but to all the technology at any time.
Reports of New York's demise, it turns out, have been greatly exaggerated. Far from leaving the Big Apple for good, more people are moving there now than before the pandemic. And that's pushing up the cost of living and hitting the poorest hard.
The will to protect his family's home gave Fabian Bravo a voice. He's fighting back against a rent increase.
They would send us tenants out into the street where no fair life is possible.
For tens of thousands, life on the street is already a reality. Homelessness in New York is the highest it has been in almost 100 years. The main cause? Too little affordable housing. More people are returning to the city than before the pandemic, and they are looking for more space. That's driving up prices. The average rent price is up by a third compared to 2021, and so are evictions. Low-income families like that of Fabian Bravo are now in a bind. Nora Bravo works as a housekeeper 7 days a week. She's already struggling as inflation is biting into the family budget.
The chicken before it cost $1.99 the pound. Now it costs $2.99 on the pound. So we have to change a little bit. Before we buy like 2 more chickens, we buy only 1. So we ask this way. So now we buy more vegetable, cucumbers, strawberry. We're looking for the deal.
The family of 5 is crammed into a 3-bedroom apartment. Their building is designed to be affordable. The city regulates their rent increases. The increase this year will come to about $70 a month. Fabian Bravo had a work injury a few years back and is unemployed. That means his 17-year-old daughter, Samantha, will help with the extra cost, instead of paying for university.
Así de alguna manera están matando con los sueños.
They are killing teenagers' dreams. If I don't speak out, if I don't raise my voice, who will?
¿Quién va a levantar esa voz?
I have to do it for my kids and for my family.
A mi familia, a mis hijos.
The city-appointed board decided to raise the rent of 1 million apartments in New York this summer. By making his case to them, Fabian wants to keep his home affordable in the future. He tells the board about the anxiety inflation is already causing his family, and he ends on a plea: no more rent increases.
Muchas gracias por su atención.
Thank you so much for your time.
And that's all for this week. Next time, we'll look at the link between COVID-19 and diabetes. See you then.